And let's now bring you news from the state of Tamil Nadu, and the schools and colleges in the state are set to reopen from February. Now, there will be no night curfew in Tamil Nadu from February as well. Now, this has come in amid consistent decline in the cases in the state. In fact, Mumbai and Delhi also continue to see their daily COVID numbers drop, where they recorded 1,384 and 4,291 cases respectively over the last 24 hours. Union Health Minister is going to chair a high-level virtual meeting with health ministers of southern states to assess the COVID situation and the public health preparedness to tackle the Omicron variant. States included are Andhra Pradesh, Kerala, Karnataka, Telangana, Tamil Nadu, Lakshadweep and Andaman and Nicobar Islands. My colleague Ayushman now joins me on the phone line. Ayushman, what can we expect in this very, very important meet that is slated to happen with the southern states and union territories? Because we are seeing the COVID numbers really going down now.
Yes, the numbers which are currently coming, they are showing a trend of plateauing, and this was a highlight that was shown by the health minister yesterday. We saw the health minister day before yesterday holding a meet with several other states from where the cases were coming, and today there is another set of meeting with other states where the numbers are on high. So the basic idea is to review the preparedness, to see how the containment strategy is on ground, how vaccination is taking place, and what is the progress of Har Ghar Dastak scheme, in which people who have missed their second dose or second dose is overdue, they have been given the doses. So overall, the situation analysis in these states where the numbers are coming will be done in this meeting with the health minister, and the focus will be on how to decrease the number of cases which are coming from these states right now.
All right, Ayushman, thank you so much for joining me with all those details. And as more and more states reopen their schools after COVID cases, in fact, show a downward trend, the National COVID Task member, Dr. Rajiv Dasgupta, in fact, has assured that it is safe to reopen schools with precautions in place, of course. Now, speaking to Times Network, he has also said that vaccination will be extended to children below 15 years soon in a phased manner.
The global experience is that it is reasonably enough to keep schools going. In fact, India is one of those exceptions where we have had schools and educational institutions closed for 600 plus days, often up to 650 days almost. The point is that schools and other educational institutions and child care institutions such as Anganwadis and creches, they need to be open for childcare services, for education, because by and large, the disease is mild in children. Even comparing vaccinated and unvaccinated children in the UK, for example, while the number of the case rates in the unvaccinated are, of course, somewhat higher, but there is no increased mortality, definitely. But it doesn't mean that it's going to be schooling as usual. Schools will have to take precautions. All states have, in fact, prepared for that. Many schools had reopened. Many states had reopened schools and educational institutions earlier, also in the interim. And schools are never a cause for rise in the cases in the community. The schools can be monitored, and schools are indeed monitored to have a fairly safe experience of education within the new rules of the game, of course.
All right, so we are seeing that the government of India has added this age category of 15 to 18-year-old children who are now getting vaccinated. About 60% of this category have been covered. Do you think now, or there are plans, or do you think it's necessary that probably we should extend it to 12 to 17 now? After 15 to 18 should be extended to 12 to 17 years?
Yes, there are enough indications that it will be extended in a phase-wise manner, which is all right, because the older children are at relatively more risk than the younger children. In fact, those children or adolescents, rather, aged between 12 to 18 years behave in terms of disease transmission and dynamics almost exactly as adults. Therefore, the obverse of this is that as far as reopening goes, reopening should actually start with the younger children, where the disease is far milder and the transmission relatively less. But yes, it needs to be extended, or at least the plan is to extend it in a phased manner.